Welcome back. We are here with Morgan Campbell and Catherine Sevier. They are answering your questions about healthcare enrollment and Medicare. Morgan, will you do me a favor and tell me what is the biggest misconception or mistake that you see or hear from people regarding Medicare?
The biggest mistake that I see is folks give up their retirement benefits. And once you give up your retirement benefit, there is no way you can ever get it back.
Why would people do that?
Sometimes they pick up the phone and someone solicits them a plan that it sounds really great and wonderful, and they enroll in the plan over the phone, and they do not know that they're also giving up other benefits that come along with their retirement plans.
So do not get rid of your retirement plan. Catherine, how about you?
I think one of the things that people don't frequently do is come prepared to really have a meaningful discussion about their health and what they need and what they know about themselves. So they don't know enough. They're not prepared to see the differences in the plans, and they think all the plans are created equal, and they are certainly not. And they also require the person to know how much they can afford. So it's a matter of money and health, and they need to be prepared to have those discussions.
All right, Morgan, somebody texted us saying, I just turned 65 and am enrolled in the state health plan. My card says I have the base plan. Do I need to sign up for additional coverage?
No, you do not. If you have the state plan, the 70-30 base plan, that is just fine.
Okay, perfect. Someone said, who should I call if I want to know if I am getting all that I qualify for? Catherine.
Well, there are a lot of insurance agents like Morgan who work with people as they are trying to figure this out. There's also what we call the North Carolina SHIP program, and that is provided through the state, and it's SHIIP. You can go on the internet and find the SHIP plan, and they have counselors who can help you look at your particular situation.
Morgan, someone said, I am retired and covered by Blue Cross Blue Shield. How do I know what Medicare to sign up for?
So if you have Part A and B, and we're obviously in our open enrollment right now, the best thing that you can do is compare the plans. Medicare.gov is a wonderful tool. You can enter in your medications, and it actually shows you how much each medication will cost on each plan with each pharmacy. It's a fabulous tool to use.
Catherine, someone said, why do I pay more of a monthly Medicare fee because I'm still working?
I'm not sure which fee that is.
Morgan, do you have any insight?
The only thing I could think of is if they're talking about IRMA, where they make more than what's allotted, and so their Part B premium is higher, and that would be referred to as IRMA, would be the only thing I can think of.
Okay. So maybe we'll get that clarified next time. Someone's wondering, my husband has Medicare, but supplement fees are really expensive. Should he change? Catherine.
What he needs to do is look at, and we were just talking about going on the Medicare.gov and looking at the plans that are there. There you can put in the particulars of your age, health, and look at the plan's availability, and there are different pricing strategies for those based on what services you need and are wanting to get from them. So there may be a way that he could pay less, but he may also have to give up some of the things that are on the plan that he doesn't need or he's willing to give up.
Morgan, someone said, I am only 49 but recently received SSDI with Medicare A and B. How do I find the best coverage for my prescriptions? I have several. Should I look into Medicare Complete Plan or Medicare Advantage, and what's the difference?
So you would need to look at a Medicare Advantage plan because you are under 65 due to disability. There's only going to be a certain amount of Medicare supplement plans that you can purchase. So in that situation, your best option is going to be a Medicare Advantage plan. And once again, Medicare.gov will do a wonderful job of comparing those plans. And there's plenty of agents that you can call that can help assist you with that, because you also want to make sure your doctors are in your network. If you find a plan and your drug costs look very, very low. Well, their next step is you got to make sure your doctors are in the network, or you're not going to be happy with that plan.
All right, Morgan and Catherine, thank you so much for your expertise today. We will be right back.